Drawing blood cultures from a central line. Blood sampling, using aseptic technique from a central line, provides easy access for blood specimens. Proper technique must be adhered to prevent contamination of blood samples and a false positive result. All blood cultures should be drawn as a peripheral venipuncture, unless there is a specific order from the provider. Here is an example. Blood cultures from a central line should only be drawn if a catheter-related bloodstream infection is suspected. If a blood culture is drawn from a central line, a peripheral venipuncture must be drawn as well. The exception: this is not standard practice for the adult and pediatric oncology population unless specifically ordered by the physician. Now that you've obtained the order, let's gather your supplies. You will need clean gloves, alcohol pads, saline syringes, Luer lock syringes, transfer devices, blood culture bottles, patient labels, lab specimen bags, needleless connector, and masks. Also, gather supplies for any additional lab work. It's important to note, if additional lab work needs to be drawn, that the blood cultures are always drawn first. Blood cultures must be drawn first to capture suspected bacteria that would be present within the lumen of the catheter. You are now ready to draw. As always, begin with hand hygiene prior to entering the patient's room. Don clean gloves. Disinfect the work surface area. Keep in mind the wet time associated with the specific disinfectant used. Turn off all infusions for a minimum of 1 minute prior to collection. Remove your dirty gloves and perform hand hygiene. If you aren't already masked, mask yourself, mask the patient, and ensure that anyone that remains in the room must be masked as well. Once again, perform hand hygiene and don clean gloves. Clamp the catheter lumen. Disconnect the IV tubing. And protect the end of the tubing with a sterile blunt needle or dead end connector. Scrub the rubber stopper of each culture bottle with a separate alcohol swab for at least 15 seconds and allow to dry. Remove the old needleless connector using strict aseptic no-touch technique. Scrub the catheter hub using friction for 15 seconds with alcohol and allow to dry. Attach a new, sterile needleless connector. This step is key in preventing false positive results from any debris that may be present in the old needleless connector. Attach Luer lock syringe to needleless connector and unclamp lumen being cultured. Withdraw appropriate volume of blood for culture: adults 10 mL, pediatrics greater than 20 kilos 2 mL, and pediatrics 20 kilos or less 1 mL. Do not discard the first 5 mL of blood. Don't forget, we want to capture any suspected bacteria that is present within the lumen of the catheter. Once blood cultures are drawn, attach specimen transfer device to syringe and fill blood culture bottles. Split the blood equally between each bottle. Adult samples, fill anaerobic bottles first, the orange top, and then fill aerobic bottles, green tops. For pediatrics, place the entire sample in the pediatric blood culture bottle, the yellow top. Additional labs may be drawn using a new syringe at this time. Remember, blood cultures must be drawn first. Scrub the needleless connector using friction for 15 seconds with alcohol and allow to dry. Flush lumen with 20 mL of normal saline using a push-pause technique. For pediatrics, flush with 2 to 10 mL of normal saline. At this point, you may resume all infusions. Document on the patient label with the date, time, and initials, site of collection, color of lumen. Attach patient label to specimen bottles lengthwise. Do not place patient label over barcode on specimen bottle or around the bottom of the specimen bottle. Place specimen bottles into lab transport bag and send to lab. Document in EHR under your LDA what lumen was used. Document that the needleless connector was changed and highlight it in the EHR. Then comment that the needleless connector was changed prior to the blood culture draw. Discard all supplies appropriately. Ensure second blood culture set is collected peripherally by venipuncture. Key points. Always verify that the order states to specifically draw from the central line. Always clarify with the provider the reason why they want the blood cultures from a central line. Use strict aseptic, no-touch technique, including hand hygiene, clean gloves, and masks. Don't forget to scrub the hub for 15 seconds. Always change the needleless connector prior to blood culture. Never discard or waste the first 5 mLs. Label all specimens correctly. Document your needleless connector change in EHR.